At a press conference at Quad AI, Dr. Päivi Salo of the National Institute of Environmental Health Sciences described findings of a study of mouse allergens and their impact on asthma prevalence in households across the United States.
My short talk will focus on mouse allergen exposures in U.S. homes. Exposure to mice is well-recognized risk factor for allergic sensitization and asthma in occupational settings. However, some recent studies have suggested that mice may also be an important allergen source in homes. To date, the majority of the studies that have examined residential mouse allergen exposures in the U.S. have targeted inner-city homes. In our study, we examined the role of mouse allergen in asthma in a nationally representative sample of U.S. households. We used data from the National Survey of Latent Allergens in Housing, which was actually the first study to estimate indoor allergen levels in U.S. housing stock. This study was jointly funded by our institute and the U.S. Department of Housing and Urban Development. We surveyed homes of nearly 2,500 individuals in 75 locations throughout the U.S. We collected information on demographics, household characteristics, and occupants' health status by questionnaire. Exposure to mouse allergen was assessed by measuring concentrations of mouse allergen in vacuum dust samples. And each home, we collected dust samples from 5 locations, from a bed, from a sofa or a chair, bedroom, kitchen, and living room floors. And it was actually quite surprising that the majority of the homes, 82% of the homes, had detectable levels of mouse allergen. And in 35% of the homes, mouse allergen concentrations exceeded a level that has been associated with increased mouse allergen sensitization rates. Mouse allergen was most frequently detected in kitchens, and kitchens also had the highest concentrations, and this is very consistent with previous studies. Elevated mouse allergen levels were most prevalent in multifamily homes, especially high-rise apartments, but also in mobile homes, older homes, and low-income homes. Our results showed that in allergic individuals, higher levels of mouse allergen significantly increased the likelihood of having asthma symptoms. Allergic individuals who had elevated mouse allergen levels in their home were almost twice as likely to have asthma symptoms than those who did not have elevated levels in their homes. Therefore, our study suggests that mouse allergen is an important household allergen. We saw that the mouse allergen exposure is widespread. It's not limited only to inner-city populations, and there's clear evidence that exposure to mouse allergen is positively associated with asthma in allergic individuals. And as we all know, indoor allergens are of great importance in relation to asthma, because most people spend a large amount of time indoors, especially at home. Therefore, reducing allergen levels is very important for asthma control and treatment. And although we need further studies to determine clinically relevant exposure levels for these allergens, it is advisable to get rid of mice, especially in homes where asthmatic or allergic individuals reside.
I'm John Geaver, MedPage Today.